Hi friends, I am Dr. Jayanti Kamat, IVF consultant, obstetrician and gynecologist practicing at Srishti Fertility Care Center and Women's Clinic, Andheri, Mumbai. So today I'll be talking about breastfeeding. We just had the breastfeeding week, but I sincerely feel that millions of women are delivering babies every second on earth. So every day is a breastfeeding day and every week is a breastfeeding week. Now what are the advantages of breastfeeding? Breastfeeding has a lot of advantages for the mother as well as the child. So what are the advantages for the child? The breast milk contains proteins and many other nutrients which the child requires in the right proportion. It is very easy to digest. It does not need any preparation. It does not need to be warmed. It is quite sterile, and it contains a lot of antibodies like immunoglobulin A and macrophages which kill the harmful bacteria, fungi and viruses. Breastfed babies also have lactobacillus bifidus, which is a very useful and good bacteria lining their stomachs, and this bacteria prevents the growth of other harmful organisms. Breast milk is the elixir of life. It is the first vaccination which you can give to the baby in a very natural way, and babies who are breastfed have less chances of having meningitis, ear infections, throat infections, allergies, pneumonia, etc. It has also been found that breastfed babies have fewer chances of having obesity, or if it is a female child, lesser chances of having PCOD or polycystic ovarian disease. Now, does breastfeeding have any advantages for the mother? Yes, of course. The suckling action of the baby contracts the uterus and lessens the amount of bleeding. The uterus quickly can go back to its pre-pregnant size. Secondly, breastfeeding burns a lot of calories, so the woman can more easily go back to her pre-pregnancy weight. Secondly, it involves skin to skin and eye to eye contact with the baby, which gives rise to a beautiful bonding between the mother and the child. There are certain studies which have found out that women who breastfeed their babies have lesser chances of breast cancer, ovarian cancer and endometrial cancer. Now the question comes, when should we start breastfeeding? Breastfeeding should be started as soon as possible, preferably in the first half an hour or 1 hour after birth. Now the question is, a lot of women ask me that, doctor, after a woman carries the baby for 9 months, pushes the baby and is so tired herself, how can you tell us that we have to breastfeed the baby as soon as it is born? As I told you, it has a lot of advantages for both the mother and the child, so why not? Another question is, how to prepare for breastfeeding? Does it require any preparation at all? Of course, it does require a lot of preparation, and this preparation should be started during pregnancy and not after delivery. During pregnancy, try to learn as much as possible about breastfeeding. You have to be mentally prepared to breastfeed the child. You have to take care of your breast and nipples. You can apply a cream on the nipples and areola to keep it supple and so that the skin does not get dry. The woman should wear a well-fitting bra to support the breast, because breast tissue does not contain any muscles. Now, what is some in our Indian scenario, there are a lot of people who take products like Shatavari. So Shatavari should be started from the 8th month of pregnancy and not after delivery. The sooner a woman starts breastfeeding the baby after delivery, the most successful is the breastfeeding program. So now the question comes as, how long should you breastfeed the child? So you can breastfeed the child till maybe 1 or 1.5 years. Till 6 months, a woman should do exclusive breastfeeding. Now what do I mean by exclusive breastfeeding? That you feed the baby only breast milk. There is no need of giving the child water or honey. A lot of people think that the child will get dehydrated, so they supplement the feeds with water. There's absolutely no need to do this, because breast milk itself contains water. So if a baby is breastfed well, it will not get dehydrated. Now what is the frequency of breastfeeding? So you must have heard this advice that feed the child every 2 hours. Well friends, it is not that easy. If your child has a normal weight, then you can feed on demand, and if your child is having low birth weight, maybe 2.5 or below that, then you have to feed the child every 2 hours for the catch-up growth. Then there are certain problems which are associated with breastfeeding. One is the inverted nipple. So you have to take care of this during pregnancy itself. You have to pull out that nipple so that the baby will be able to suck after delivery. And if at all you have such problem, you must talk to your gynecologist that you would like to breastfeed the baby, and anything coming in your way should be discussed with your gynec. Another precaution is a breastfeeding mother should always wipe the breast with a cotton which is dipped in clean water and a little soap, and she should always keep herself clean. All the clothes which she wears and which are contact with the body should be washed daily, and they should be clean to prevent infection. So friends and all young mothers, enjoy your motherhood and breastfeeding, and if you have any doubts, you can contact me on lybrate.com. Thank you.